Hello and welcome to Naficy Rejuvenation Center. We have a special video planned today where 4 of our expert injectors are going to be answering the questions that you submitted on Instagram about topics regarding Botox and other neuromodulators, dermal fillers, Sculptra, Selfiena, facial and hair restoration, Kybella, and more. So let's jump right in and meet our injectors. Hello ladies, thank you all for joining me today. We have a lot of great questions from our Instagram followers, but before we get started, go ahead and introduce yourselves.
Oh, hello. I'm Christine Woods, nurse injector here at Naficy Rejuvenation Center.
And I'm Lauren. I'm also a nurse injector here at Naficy. I've been here for about 5 years, and I also am a trainer for Galderma.
Hi guys, I'm Jill Candora. I'm a physician assistant with my background in cosmetic dermatology. I'm an injector here predominantly here at Naficy, and I've been injecting for the past 8 years.
And I'm Yvette Del Piero, nurse injector here. Been here about 6.5 years.
Perfect. So let's jump right in with our most frequent question. So Lauren, many people were asking about filler migration. What are your thoughts about filler migration and what can you do to prevent it?
So filler migration, interesting question. I don't think that filler can really necessarily move from one area of the face to another. However, I think that filler injections can have some unintended consequences based on how things are being injected. For example, if you look at the lips, if someone is maybe overfilling the lips a little bit too much or injecting in an incorrect placement, then the lips can look like, maybe some of the product has sort of bled outside the lips, and so they see swelling or see some type of result that they're not happy with as a result of that. So I think it's just mostly, and all those things can be corrected, but I think that's why it's really important to make sure that you are seeing someone who really understands the face, the anatomy, and precision with their injections to try to avoid that happening.
Like you guys, right? Mm-hmm. There we go. Perfect. So another common concern with fillers is bruising. Many of our patients want to minimize bruising and worry about filler being injected with a needle. Does anyone use cannulas for the lips? And if not, what are the benefits of using a needle?
Okay, I can start there. I do use the cannula in the lips. I think you can get a great result doing no matter what. I use a combination of cannula and needles. I learned on cannulas before even doing injections with a needle. So for me, it's more of a comfort. I understand that realm, but I think you can get great results regardless. And if anyone else wants to add anything to that.
Bruising can happen anytime we use a cannula even or a needle in the face. It's a temporary result, so I think it's something just to manage when it comes to icing after or pre-injections, avoiding things like aspirin, Aleve, ibuprofen, things that thin the blood. Red wine's another big one, fish oil. Do what you can. Obviously some prayers work sometimes well as well, but it's temporary, and as long as you're happy with your beautiful result, we think it's completely worth the procedure.
Yeah, I agree with that.
Mm-hmm. Absolutely.
Perfect. Yeah. So Jill, with your background in dermatology, would you recommend PRP with microneedling for under eyes as a first step before fillers?
So also a good question. I think most of us are going to say whenever you ask us a question of what we recommend, it's going to completely depend on the patient. Anatomy ranges from patients when it comes to their ethnicity, their age, just how much sun damage they have, just genetics. So to say that one or the other is hard without knowing the patient we're evaluating. I think the nitty-gritty, just kind of simple answer would be I typically gravitate toward PRP and microneedling when I'm trying to change the tissue under the skin, meaning build some collagen, help with fine lines and wrinkles, kind of actually increase or decrease elasticity under the eye. Where fillers I'll sort of gravitate to when there's more of a volume loss. So if I'm actually trying to fill in hollowing under the eyes, which we call the tear trough. A lot of times a combination of both is beautiful. We can get some volume restoration with PRP, but it really depends on the patient. So. Awesome.
So if you were to advance to using fillers under the eyes, what do you like to use and how many syringes are typically used?
Same answer as before. Completely ranges. I will say tear troughs are one of the more complicated, tricky areas for every injector, novice and advanced. I think number one, evaluating structures around the eye. So a lot of times you're going to hear us talking about addressing the cheek or addressing the temples to support the under eye area as a first step. When it comes to actually treating the under eyes, I think depending on the day, I might give you a different answer on which filler I towards to like more. I think Restylane regular has been our kind of go-to, but I've had great success with other products and other techniques in injecting. And then how many syringes? Same answer. It depends. It can be one syringe split between under eyes. It can be up to 2 to 3. It can be even done in a series of sessions. So it just kind of depends on the patient.
Perfect. Thank you. So as we know, dermal fillers get a lot of coverage on social media, but this has left many of our followers curious what the difference is between dermal fillers and dermal volumizers like Sculptra. Chris, could you expand on this?
So dermal fillers, like hyaluronic acids, are going to give you more of an instant result. They are reversible, so some patients like that idea. Sculptra, I love Sculptra. It's a very beautiful natural product. It's a polylactic acid. It's a biostimulator, so what it's going to do is stimulate new collagen. That can take time though, so it's not an instant result. Some patients want that instant gratification. So it just really depends on what the patient wants to do. I love Sculptra though. It usually is one of those treatments that takes a series. So I'd like to see patients back maybe 4 to 6 weeks and we retreat. Most patients we're looking at with Sculptra doing about 3 treatments. Some need more than that as well. We're putting Sculptra all over the body now, including the buttocks, like what the Kardashians have done. I've actually done some of my belly button for my stretch marks from having my baby.
Yeah.
It's a great product. Although I do love my hyaluronic acids as well, I think it just really depends on the person.
Perfect. Thank you. So let's move on to a category of injectables that's equally as popular, neurotoxins. Yvette, what do neurotoxins treat and what neurotoxin products do we offer here at Naficy?
The neurotoxins that we offer here are Botox, cosmetic, Dysport, and also Jeuveau. And what neurotoxins do, it relaxes muscles that contribute to facial expressions that create these wrinkles or rhytids on the skin tissue. And we treat basically any muscle in the face. Certain products are FDA approved for the glabellar region, which is responsible for the 11 lines. The frontalis muscle, which is responsible for the horizontal lines, and crow's feet. Those are the 3 more common areas that we treat with our neurotoxins.
Perfect. And if a patient did decide to move forward with neurotoxin injections, but particularly Botox and the masseters, do they need to remain on a regular treatment schedule, or are a couple treatments enough to maintain the desired effects?
That's a very good question. The masseter muscles, which are these muscles right here, they, like any other muscle on the face, it needs to be maintained if you want to continue with the results. Typically, when we're doing neurotoxins, we recommend every 3 to 4 months to come back for repeat treatment. Same would go with the masseter muscles. It takes a while to really weaken and cause atrophy to the masseter muscles to keep that narrow effect of the lower face. Or if you're trying to treat for TMJ, it takes a while to really cause enough weakening of the muscle so that you don't have those issues anymore. Initially, I would recommend people to come in every 3 to 4 months, and sometimes, if you're lucky, the muscles weaken enough that you can extend your treatments further apart.
Perfect. One of our followers who had never received Botox wrote in about a treatment in the forehead region. She noticed some individuals who received Botox experienced the neuromodulating effects in the forehead lines, but not in the hairline. The hairline still remains slightly mobile. Is this normal, or do you typically treat the hairline as well?
I think it's individual based. So there are people that their frontalis muscle does extend past the hairline. Oftentimes you don't necessarily see it maybe that first time. So someone may come back in a week or 2 after their treatment has settled in, and they're noticing that there's still a little bit of movement at the top of the forehead. And in that case, or if they're just feeling, when they do sort of raise their eyebrows, if they're feeling movement past the hairline, then it may warrant us treating beyond there. But it still is treating the same muscle. It's just everybody's anatomy is a little different.
I know that the frontalis muscle kind of, it separates right at the midline of the upper forehead. So sometimes you'll see movement there, but there's not necessarily a muscle that we can inject to treat. So that's just your anatomy, and that's okay. And I think also it's just being able to get the right number of units to eliminate as much muscle movement as possible. So sometimes more is what you need.
Yes.
Thank you. So this concludes our conversation on Botox and fillers, but there are many more treatments that you guys offer, so let's jump into those. So starting with the procedure that has skyrocketed in popularity within the U.S., thread lifts. It's a non-surgical way to lift sagging tissues in the face. Chris, we had a patient ask, will a thread lift be useful to correct minor sagging in the lower face and beneath the chin?
That's another really dependent on the patient's anatomy and how much sagging we have. You know, it really is one of those things where we have to get a patient in to evaluate and see if they are appropriate for that type of treatment. Threads are awesome. They can really give you a nice natural lift. It also helps stimulate collagen as well. And we do like to combine that with Sculptra as well. So there's a process with that, and it's definitely something we would all recommend that the patient comes in, we evaluate them in person.
Okay, great. And will PDO threads ever need to be tightened, and can they be removed?
There's no tightening involved like after they're placed into the tissue. They can be removed, although we have not had to do that yet. It's a process that we would have Dr. Naficy look at and probably assist us with, but that's definitely not something we've done yet. Usually the thread it'll just absorb into the tissue, and from there you really won't feel it after probably a few months. Then it starts to stimulate that collagen. So we really advise you just to kind of wait it out if that is a problem.
Okay. And then, Lauren, a question came in that relates to the lower face and neck as well. Can you talk about Kybella and how to know if you're a good candidate for Kybella, or if you should pursue something like thread lifts or a neck lift?
They're really looking at different causes. So Kybella is actually an enzyme. It's deoxycholic acid. Its goal and what it targets are fat cells. So it's not really meant to treat anything that is related to laxity. So if someone is noticing that they have some fullness, that no matter what weight fluctuation, they're still experiencing this fullness, and if we assess it and we can tell that it's because there's a little bit of excess fat tissue there, then we most likely are going to recommend Kybella for you. However, if you're experiencing that and there's a lot of laxity in the tissue, and potential sagging, then that's something where we would hand you off to one of our patient care coordinators and maybe have you talk about a surgical option, because there's no benefit necessarily to taking away the fat if it's only going to take away some support to the tissue, and then have a little more appearance of the sagging. So it really is dependent on what your actual case is and how we would approach it.
Thank you. So expanding on treatments that target fat, Naficy Rejuvenation Center also offers Selfiena to treat cellulite. Yvette, this patient says, I know Selfiena treats cellulite by targeting connective bands in the buttocks and thighs. Can this cause damage to the collagen and elastin bands in those regions as well?
Very good question, and yes. When we perform Selfiena, we are very selective of which patients we can treat and also which cellulite dimples we can treat. It's FDA approved for moderate to severe cellulite dimples, so a lot of people have these really mild irregularities on the skin tissue that look like cellulite, but in reality, if we were to overtreat these mild dimples, you could actually cause more of a reversal effect where you're disrupting healthy collagen and skin tissue, and it can create a fat pocket. So yes, the answer to the question is it could disrupt some healthy collagen and cause more damage, but that's why we're pretty selective with which dimples we can treat and which patients we can treat as well.
Wonderful. So our last couple questions regard sclerotherapy and PRP. Can PRP be combined with ACell for use on the face, or is this combination strictly for hair restoration?
So in our practice, it is strictly for hair restoration. ACell has been a great adjunct to PRP injections alone to help stimulate stem cells within the hair follicles or within the scalp to regenerate new hair growth or to strengthen the hair that patient does have. We have not combined it yet. I don't believe we have for facial rejuvenation at this point. So you'll have to stay tuned to hear more about that. But at this point, no.
Yeah.
Awesome. Can sclerotherapy be used to treat varicose veins caused by pregnancy, and is it safe to do while pregnant?
Well, sclerotherapy is really meant to treat kind of spider and reticular veins on the legs. If you have varicose veins, they should be assessed and diagnosed by a vascular surgeon, in my opinion, and we do have a vascular team that we refer patients to if they can't be treated with our sclerosing agent. But varicose veins, in my opinion, are not treated by our sclerosing agent, and we refer you to a specialist, and it's not indicated to treat pregnant women.
Okay, thank you. So let's conclude this Q&A with a fun question. Does anyone want to share one of their most memorable patient experiences?
Well, okay. I would say, not to like minimize anyone's experience with us. I won't talk about like a specific patient because I think that every experience is a great one for me personally, and I'm sure they feel the same way. We get to come into work every day and we get to make people really happy. We get to change and improve their confidence levels. I can tell you from my own perspective, seeing patients come in that have something that's creating an insecurity, and then treating that insecurity and then having them come back and seeing them for future treatments and just seeing the progression of how they kind of come to life a little bit more, and how people, it's a really personal thing. All these treatments are personal. You're not doing it for anyone else, or you shouldn't be. You should be doing it for yourself. And so to see people's confidence levels improve over time, it's amazing.
I agree with Lauren. I've been doing this for years, and I feel like I've created a family of patients. I think my patients have become part of me, and I am so invested in them getting the results that they're looking for, or giving them the education that they need when it comes to what treatments are best or what treatments we don't recommend, and just creating that trust and bond. We also treat all of our new patients the same way. We want to give them education and build that trust with them. And then for me, coming from other practices and being here, I've been so lucky to be here because we have so many experts under one roof. We also have so many treatments under one roof. So really watching patients go through the practice and see them with other providers and see how we collaborate together is such a unique and such a special experience we have here at Naficy.
Thanks, Jill.
Oh, yeah, you're welcome.
We love each other,
Yeah.
clearly. We have a great team.
Yeah,
Yeah.
absolutely.
Well, I think this concludes our Q&A. Thank you guys so much for your time.
Yeah,
Thank
thank
you.
you.
To schedule a treatment or personalized consultation, call us at 425-450-0880 or go onto our website at seattleface.com and click on the online scheduler. We also have an Instagram, so go ahead and follow us at Naficy Center or our own Facebook page. Thank you, and we look forward to seeing you soon. Bye.